So the cardiology program at UHS has consistently advanced over the last about 40 years, but in the last few years the progress has been quite steep. We have hired a lot more doctors with very advanced specialties, and now we perform all aspects of cardiology. So short of heart transplants, we do everything in cardiology. And we do it quite well. New York State monitors quality of cardiac programs by collecting data from all hospitals in New York State in a mandatory fashion. So in our PCI program, which is the program of doing heart catheterizations and putting in stents and treating heart attacks, over the last few years we've come out better than the rest of the New York State at least twice, and we have never come out below anybody in the New York State and the New York State data for the last 30 years. In addition, we do cardiac rhythm procedures with excellent outcomes and zero mortality. So these are long-standing, highly successful programs at UHS, and patients can count on getting good care. In addition, we have started brand new procedures like doing percutaneous replacement of aortic valves. Dr. Yarkoni does a great job there, and his outcomes are better than the rest of the New York State. Over the last couple of years, we've had zero mortality in that procedure, which is a big accomplishment because these patients are usually so sick that they cannot even undergo open heart surgery. Similarly, we have started a program for stroke prevention in patients with atrial fibrillation by putting in a closure device in the left atrial appendage called the Watchman. We do 2 or 3 patients every month with excellent outcomes and no complications. So we're very, very proud of the overall progress made at UHS, and our cardiac program is highly successful for providing high quality and safe care for patients. Our cardiac surgery program has improved over the last a couple of years significantly to reduce the complication rate, and outcomes are now much better as compared to what they used to be. So again, we're very proud of the progress made at UHS, and we continue to hire doctors who are recently trained to improve the quality further. Recently, we started a program called ECMO, which is cardiopulmonary bypass done outside the operating room. So if a patient comes in with a massive heart attack, we now have the technological capability to put them on a heart-lung machine and support their heart until the heart can rest and recover. This was not available even 2 months ago. These patients usually do not survive, but now we have ways to help them. And in an ECMO program, about 40 to 50% of the patients who go on ECMO actually do survive, whereas 100% of them would have died otherwise. So this technology is not available in this region other than at UHS. This degree of advancement requires not only good physicians, but setting up the whole program. So we have 8 nurse practitioners, we have 2 advanced practice providers for cardiac surgery, and in addition we have a teaching program which trains fellows, nurse practitioners, other advanced practice providers, and residents along with nurses in all of these new technologies. Before starting the ECMO program, we had to train 30 different nurses to be able to provide round-the-clock care for those patients. So bringing anything new is a large endeavor and requires the whole team, and I'm very proud of the cardiac team at UHS for maintaining the quality of care and safety of care, and also for advancing the care as it has been